Welcome to Part C of Seminar 4 on addiction. This seminar has been looking at specific substances that cause problems of addiction, and this section is looking at sedatives and cannabis. This section of the talk is about sedatives, which includes sleeping pills or anti-anxiety agents. The most common medications in this class are called benzodiazepines, or benzos for short. The other two groups include the Z drugs, which are prescription sleeping tablets, such as Stilnox or Imovane, and then the third class of the over-the-counter sleeping pills or sedatives are basically antihistamines or the alternative medicine valerian. The benzodiazepine class includes Valium, temazepam, Xanax, which you may have heard of as a commonly abused drug on the street, Seropax or Muralax, Rivotril, FAChAM, or Ativan. So we'll just go on to look at how this class of drugs, particularly the benzodiazepines or benzos, are used and abused. Looking at benzo effects on the brain, benzos essentially reduce the arousal of nerve cells generally, and this particularly affects the smart brain or the frontal lobe, as we've heard about before. This is the part of the brain where one's higher level thinking occurs, such as moral decisions, inhibitions, and by reducing the arousal of this part of the brain, it leads to a reduction in anxiety or self-criticism. This can then lead to a lowered inhibition when excessive amounts are used. When going beyond the use for just anxiety leads to a disinhibition, increased energy and self-confidence, and also impaired memory. Because it takes away negative feelings, it can become addictive. Not only that, it rapidly develops a tolerance to its effects. Therefore, after some weeks on a benzodiazepine, one may have difficulty stopping it without getting a rebound in anxiety. So it is a very useful medication for treating anxiety, but it is generally a short-term treatment. So anyone who's on this for any length of time may have difficulty with the rebound arousal that occurs, and we'll talk about the withdrawal syndrome a bit later. So why are benzos used both in the medical sphere or the non-medical sphere? In the medical sphere, benzodiazepines are used short-term for anxiety, particularly to manage short-term stresses, for example, losses or trauma. It's also used for sleep, again in the short term for the same sorts of reasons, but may also have a role augmenting the effect of other medications such as antidepressants or antipsychotic drugs when treating mental illness, and it has a role in treating muscle spasms as well. For example, people with acute disc protrusion in a back pain situation. In a non-medical situation, it's generally used for its intoxicating properties, basically to be out of it, if you like. It also is used to reduce withdrawal problems coming off amphetamines or heroin as a way to make that withdrawal easier. But it has been used also quite dangerously to boost the effects of opiates, and it can result in overdoses for that reason. Benzos or sedatives in general do contribute to overdose deaths. This is a graph showing the number of cases of overdose death where the various substances were represented. One can see that opioids are far and away the most common cause of overdose deaths, and benzodiazepines are second, and it's important to realise that this is always in combination with other medications. Benzos by themselves do not cause overdose deaths, but in combination with alcohol or opioids, they certainly do contribute. The main approach to this has been to limit the amount of benzodiazepines available, and anyone who is prone to abusing benzodiazepines, then they are restricted to what we call a staged supply. That is, they're only handed out in safe quantities. These are some of the other problems associated with benzo use, and these include accidents due to loss of control of one's body or inattention, memory blackouts, similar to that which occurs with alcohol blackouts. That is, a person may have no recollection of a period of time during which they may have been heavily intoxicated. During such a time, that person may have been acting in a disinhibited way. Then there's the problem of withdrawal seizures. These can occur up to a week after stopping the benzo due to the slow metabolism of benzos. Sleep apnea, the exacerbation of problems with breathing during deep sleep. And then addiction, which is a particular problem with those who find that benzos relieve anxiety very well in the short term. They become tolerant of the medication and then find they can't go without it. So withdrawal leads to an exacerbation of the anxiety, and people form a belief that they simply can't do without their benzos. So how do we manage benzodiazepine addiction? It's important to remember that abrupt stopping of the medication is not recommended. It can lead to life-threatening seizures, and a thorough assessment needs to be performed before a management plan is developed. There are two general approaches. One is a gradual withdrawal with the aim of abstinence. This has a long-term failure rate, which is fairly high. The other approach is benzodiazepine maintenance, which is generally the safest approach, particularly people who are somewhat chaotic and have other problems going on. It tends to be that a person, if they don't have the medication, can buy it on the street and end up with a whole bottle full of pills, whereas maintenance therapy, the person has a limited supply which they tend to rely on and don't go looking for other sources. So there is a choice there, and generally the maintenance therapy is for people who are a bit more chaotic and less compliant with the idea of withdrawal. In all cases, medication should be supplied in a small, safe quantity, and depending on how much the person can manage at a time, and this can be dispensed anywhere between daily or weekly. Other aspects of treatment includes having a psychologist to work through anxiety issues, develop skills there. It may be a role for antidepressants, which help a lot with anxiety. And then the GP would generally monitor the person for other sources of benzos, such as using my health record to look for other visits to other doctors. We're now looking at cannabis or marijuana or hemp. This is a plant that's been used for possibly tens of thousands of years as a fibre, as a food. That is, the seed is used as a food. The seed oil, which is actually not intoxicating. The flowers themselves produce an oil which is intoxicating and probably has a protective role against insects. It's indigenous to Central and Southern Asia, and hemp cloth has been identified from archaeological digs being up to 8,000 years old, 8,000 years BC. Hemp fibre has been grown for rope or canvas since the 1600s. In fact, that's where the word canvas comes from. It's a variation of the word cannabis. And it became more popular in Western Europe after the Napoleonic forces returned from Egypt, and there became somewhat of a fad in France and to a lesser extent in the US. And in fact, in the 19th century, many medicines contained cannabis. But it was really in the early 20th century when, following the Mexican Revolution, many Mexican immigrants brought marijuana over the border, and because they were also a threat to jobs, especially during the Great Depression, there was a general public reaction and resistance to both the Mexicans and the marijuana. And after some lobbying by DuPont, which had a vested interest in producing synthetic fibre, hemp cultivation was actually banned in 1938, and cannabis has been made illegal since. So the pattern of cannabis use, it's generally onset in teens, mid-teens, sometimes earlier. Addiction can develop in maybe 10% of those who ever use, but the risk of addiction is higher in those who are more frequent, such as daily to weekly users. And the younger the onset, the more likely cannabis is to become an addictive problem, up to 6 times the rate of addiction with young onset use. There's a greater vulnerability with mental health problems and home life or parental difficulties. But many people cease or reduce cannabis during a transition in life roles, such as getting married or employment, pregnancy and childbirth, and about half of addicted users will stop over a 5-year period. So let's look at the overall problems associated with cannabis. These include the effects of THC exposure to the brain, THC being the active component of cannabis. It can cause mental health issues, including increased risk of psychosis. It can affect teen brain development. It can affect fetal brain development and subsequent child development through maternal use during pregnancy. It can cause impairment of motor skills, which can affect driving and workplace risk, and it can cause addiction. There are also legal issues associated with cannabis use, which can affect later opportunities. And then there's exposure to combustion products from cannabis, which produces a similar effect to tobacco smoking, although this is not as well documented as the problems of tobacco smoking. Then there are increased risks to the actual pregnancy itself, such as low birth weight. Looking at the effects of cannabis on mental health, cannabis increases the risk of psychosis by about double the rate. In heavy users, this can be up to 4 times the rate, and in early onset users, those beginning before the age of 15, the rate of psychosis can increase 6 times. It also comes on earlier, which on average 3 years earlier, and this erodes the educational and psychosocial development of a person prior to the onset. So the person is less well equipped educationally and socially at the time when the psychosis comes on, which bodes for a poorer outcome at the end. And cannabis also makes treatment less effective. Even in the absence of psychosis, cannabis still has effects on the brain. And in long-term heavy users, there's definite effect on memory and attention, and that's not just when the person is stoned. Adolescents may have lasting effects on their thought process and the capacity of their thought processes. And there are changes evident on brain imaging which are actually worse with increased exposure to cannabis. During child development, that is exposure in the uterus, subsequent child development can show deficit in attention, impulsivity, learning, memory, and executive deficits. So how does cannabis affect driving and work skills? Cannabis impairs automatic behaviours, for example, staying between the lines when driving. People are usually aware of that impairment, and when they're more affected, they compensate for this or don't drive. Nevertheless, cannabis use approximately doubles the risk of motor vehicle accidents. Alcohol has a different effect. It tends to impart a sense of false confidence. And therefore, when alcohol is combined with cannabis, it removes the ability to compensate or the tendency to compensate. So alcohol and cannabis together have a multiplying effect, with cannabis approximately doubling the risks associated with alcohol use. It's also important to remember that cannabis is detectable in the urine for weeks after use if people are using regularly, and this can affect work opportunities. Just a few points about the legal issues associated with cannabis use. Criminal convictions for people in their early adulthood may limit further job opportunities or travel opportunities, for example, to the USA. It also increases culpability if an accident was to occur. Decriminalisation is an approach to this issue, and it's different from legalisation of cannabis, which refers to allowing recreational use. Decriminalisation may involve having a fine instead of a criminal conviction, This is called a cannabis expiation notice, and if the fine is paid, then no conviction is recorded. There's also the option of a magistrate referring a person for brief intervention or treatment rather than for a sentence of a criminal conviction. There's also the option of discretionary cautioning by police officers. And in New South Wales, we have this scheme where police are able to caution for quantities up to 15 grams, providing a person hasn't had a prior conviction. We also have the option of magistrates referring into treatment. This is called the Merit Program, Magistrates Early Referral into Treatment, and can occur at the local court level. Regarding medicinal cannabis, this is not an option yet for addiction and is only really available for conditions such as childhood epilepsy, multiple sclerosis, and advanced cancer. Regarding the management of cannabis dependence, looking at 5 main areas. First is motivation. This often takes time or a change of circumstances for motivation to develop, but certainly can be facilitated through counselling by a drug and alcohol counsellor or a psychologist. And there is an online service called Alcohol and Drug Information Service, which offers online programs and a 24-hour support line. Then the actual process of coming off cannabis involves 2 aspects. One, learning self-management skills. This is essentially a talking treatment done in either in a one-on-one or in group setting or online possibly, and management of withdrawal, which can be done through a GP generally, occasionally requires inpatient for severe withdrawal associated possibly with coexisting mental conditions. It may require that sort of support, but generally can be done in the community with short-term medications. Coexisting mental health issues are fairly common. Psychosis can occur. Possibly 1 in 7 people can't tolerate cannabis because of its effect on causing psychosis or mental health issues. But depression and anxiety may have been present, which have given rise or promoted the use of cannabis. There may also be a history of trauma, which may require regular psychological counselling over time. General problem solving is also necessary in terms of state debt from fines, accommodation, legal issues, and centrelling. Smart Recovery Australia is a psychologically based group support network. They're often local support groups. Probably suits young adults more than teenagers. Occasionally there are teenage smart groups, but this is unusual. Younger teenagers would be better served through a one-on-one counselling situation. But Smart Recovery Australia is a very accessible support group for young adults. This slide just looks at the time course of cannabis withdrawal and looking at the key features. There are 4 core symptoms: anxiety and restlessness, anger and aggression, appetite loss, and insomnia or disturbed sleep from strange dreams. It evidently peaks in the first week or so and gradually drops off over a 4-week period. Withdrawal management may require no medication, just support. Occasionally medication is required, and it can be supplied by a local GP in the form of some short-term diazepam for insomnia and irritability. If this is insufficient, then quetiapine in a low dose may be used, or for low mood, mirtazapine in a low dose may be used. These would be certainly at the discretion of the GP, but these are the options that are available. When care is needed to be stepped up a bit, there are some options. So for more intensive treatment, Hunter Primary Care do offer some specific drug and alcohol counselling services for mild to moderate substance use. Newcastle Cannabis Clinic is a specialised cannabis counselling service. Mental health substance use service is for those people with coexisting mental health issues such as psychosis or severe mood disorders. Withdrawal management can be assisted through the Mater Alcohol and Drug Services, or through Lakeview, which is an inpatient medically supervised withdrawal service. For general support and self-help, then Smart Australia or NA, these can be found on the internet where the local groups are. And for practical help, non-government organisations such as Wesley, Samaritans, Matthew Talbot or Nova cover a range of different options. That's the end of this series on specific substance use disorders. This is a list which you've seen before regarding support for families who wish to help their loved one in substance use. There is family drug support, Samaritans Recovery Point in Newcastle, Nara Non, which is available Australia-wide. There are some internet interventions such as the Family and Friends Support Program, and Smart Recovery Australia has a support group specifically for families called Be Smart. So thank you again, and thank you to Community Drug Action Team Port Stephens and Raymond Terrace Public Library.